Good morning, good afternoon, everybody. Let me say something about the project and the organization of this network. My name is Carmela Coterone. I'm working for the Campania region, public administration, and we are leading a project called MIDINET, When Brand Meet People. This is a project promoting the Mediterranean diet as a theme to develop sustainable small enterprises for young people in rural areas, and to preserve the Mediterranean diet as a tradition and a cultural heritage. We are 13 partners in Mediterranean northern shores, and we to keep alive during this period of the pandemic difficulties. We organized, also thanks to our partners, Spanish partners, several webinars to discuss about the Mediterranean diet and the connection with the pandemic and the future after this COVID-19 period. Now let me introduce you, Giuseppe Gramigna from United States, from Washington, D.C. Giuseppe is a chief economist. It was a chief economist of the SBA, that is an agency, federal agency to support the small and medium enterprises in America, in the United States. He is working for World Bank as a senior consultant and in several other international organizations. For example, for OECD, the Organization for Economic Cooperation and Development, the Association of Economic Cooperation in Asia, and the Asian nations. And he is part of boards in several academic institutions and also in no-profit entities, assisting always the development of SMEs. Giuseppe is very, very interested in Mediterranean diet, and I proposed him to tell us what he think is important in Mediterranean diet and in the relation between the Mediterranean diet and the US market. Giuseppe, the room is yours. Thank you for coming.
Is the title, and as I mentioned, I will have 4 simple propositions that will lead to 2 business lines. One is a very large export market for products that will be medically certified foods produced in your regions, and 2, a smaller but much more lucrative import market by the form of patients to be brought for medical treatment and culture in your region via medical centers of excellence. These activities and firms basically provide a very robust revenue lines that will catalyze the enterprise and economic development in your regions. And then I will finish with a set of what I consider next step for us to potentially collaborate how to make this reality. So the proposition 1 is that a large body of scientific literature strongly supports the Mediterranean diet as a preventative medical treatment, not curative, preventative, for many morbidities such as diabetes, obesity, Alzheimer, and many more. Proposition 2, the treatment entails a strict adherence to food intake regimen individually prescribed by a medical practitioner. A portion of these patients will be able to adhere to the strict regimen with minimal guidance and limited supervision. This group will basically make up a sizable, very large export market for the Mediterranean products that will be certified as medical foods that are currently being produced in your region. The fourth and final proposition, a portion of this group will require additional guidance and supervision and will make up a smaller but much more lucrative market that will be imported into your region via medical centers, and that's where you will provide a package of services based not only on the diet, but also the culture, the history, the climate in your region. So these become a high value lifeline, economic lifeline for your agricultural sector, your cultural sector, as well as your healthcare sector and your tourism sectors. So what about the market size? I'll give you some numbers, but the conclusion is that potential market size is not an issue. It's huge. So let's just look at the US market for diabetes. And you can see it's huge. Basically, if you take all the population, 324 million, of this, take the prime working age, you'll come up with 169 million. Of this group, let's just focus on the high income with income greater than 75,000. You still have 72 million people. Now, the diabetes rate in the US is 13%. Now, remember, the obesity is 37%. So I'm looking at the smallest market. So this market is really 9.4 million. If you then just assume that we would penetrate 1% of the market, that is 94,000 patients per year. Now, let's look at the same concept by healthcare expenditures. In the US, we spend $3.8 trillion. I wanted to put all those zeros so that you can see when I looked at these numbers, I had to say, is this real? Yes, of which the diabetes is $542 billion per year. 1% of this is $5.4 billion. If you just take then the annual diabetes treatment divided per person, and that is the 94, you'll end up an average 94,000, excuse me, you'll end up an average expenditure per person of 13,000. The same numbers if you divide them differently. So if you go down this logic, the potential diabetes market is $1.2 billion. So we didn't count the EU, we didn't count the diabetes, we didn't count the possibility of insurance paying and contributing to this. So again, the conclusion is market size is not the issue. What are the issue? Well, let's go into each business line and you'll see what I mean. Your region already have small and medium enterprise that produce agricultural products based on the Mediterranean diet. This becomes the basis of the export. What is needed is an enterprise that certifies, markets, and distributes their production across the US or other region. So we can use the nutrient hazard analysis and critical control point process developed by the University of Roma, Tor Vergata, but I suspect that the University of Napoli also may have something along the way or similar. But this regimen basically not only certifies the food as biological or organic, but also medical food where the actual ingredients and efficacy on the patient are quantified. So let's look at the import side. There is a need for this business to develop for an enterprise that builds, operates, and markets these centers of excellence. Again, the two universities that I mentioned could be the basic foundation for the diabetic treatment. And as I mentioned, then we would add cultural, climate, tourist component as a broader package to assist these patients. So what I've described is what I call a multi-source revenue model. And in economics, having a multi-source is extremely important. The first source will be the exporting of high-value certified medical food products abroad. Here we just discussed the US, but it could be the US and Europe, the Middle East area, all sorts of area. The importing of demand for services based on the Mediterranean diet, culture, and climate, with two additional optional ancillary service, one based on the aftercare market for goods and services. So these patients, once we treat them, we will follow them for the rest of their lives, or as long as they would require those services or desire those services. And then expanding the center of excellence physical footprint to include residential and related services to retirees and health conscious tourists. So the goods and services that you provide to one market, you also provide to all these other markets, increasing the economy of scale and reducing the average variable cost and changing the cyclicalities and seasonalities of these revenues that will then generate different types of revenue streams. Their combination should provide a robust and steady revenue streams that can serve as a strong basis for enterprise or supply chains of restaurants, tourism, hotels, transportation, education, all these things, which will lead to economic development in your region. So let me, having briefly described these things, and I do say briefly because I assume you folks are very aware of these things, what would the COVID-19 implication be for this? I think there are actually two positive. Once this pandemic is somewhat resolved, either through time or, God willing, through a vaccine, COVID-19 experience should increase the distribution channels across the EU and the US via online ordering and delivering service, which we have already seen. So they will be already developed and available for us to leverage. Also, and very importantly, it should augment the market potential on the export and the import side, because we realize that diabetes and obesity are significantly contributor to higher mortality rates of infected person. So that which we always know, that a healthy lifestyle makes for a healthy person. And when I mean lifestyle, not just diet, culture, family, environment, makes for a healthy, more resilient person. So the next step that I like to propose is, one is to have an executive working group with decision-making authority to quickly establish the level of interest of these concepts in your regions or various partners. Then this executive group will appoint an operational working group to identify the feasibility of any of these concepts. And then the executive group comes back and decides whether, if, and when we launch the enterprise. So thank you. and I'd be delighted to take questions.
Thank you very much, Giuseppe. I would say something me too, because you are exactly in line with our ideas in our projects, but more you have done a concreteness in terms of the possibilities of the market and the possibility of the future of our network to develop sustainable activities in our regions. I keep immediately the proposal you made about the organization of a working group. I don't know what happened in the link, because we are only the people inside the partnership today, because maybe it was a problem in the link. So I can say something for all the people around this conference, because they represent also the most of our partners, to propose to work on your proposal, to work on the working group, on the preparation of this part of inside our project. So it could be a part of capitalization of all our activities in a very concrete way. Maybe there is some Francesca from Scabek is asking for something that you can answer, of course. Francesca is saying, but do you think that exporting products from EU to USA is coherent with the MED-Diet principles?
Yes, it will require a certification process so that these foods will be certified as medical foods. It will require a distribution channel of vectors, and they will be the medical practitioners. And it will require a fast distribution, a logistic approach, most likely by airplanes from Europe to the US, and then the local distribution, whether it's done. Basically, you can use the courier system concept of hub and spoke that can deliver goods or parcels, whether they're frozen or not, whatever, within 2 days. So yes, it's expensive, but it can be done. And I submit to you that with time, the relative cost will go down, because these distribution methods would be much more developed. And we thought 5-10 years. We're probably talking 20 months. So yes, it is very much in line, and it leverages all these things.
Also, because we have to think that the alternative is the medical treatment that is in any case very expensive in USA.
Exactly.
For diabetes, for example.
Exactly. So if you look at the $12,000, it's really 13,000. But that's an average overall. The actual cost is probably 16 to 17,000. If you then say, okay, I'm going to reduce your medication to a third, 1/3, because that's what happened to me. Basically, that leaves you a $10,000 bill that you no longer have. You can basically say, okay, I propose that I provide food to you at an additional $8,000 a year of your already existing food. So the already existing food bill is about $150 per person. That is about 8,000. You double it to 16,000. You're still are proposing a $10,000 overall expenditure cost purely directly. That doesn't include the additional work life that you will get, the additional quality, the reduced costs of medicine, which if not the healthcare industry might not be so interested, but we have a solution for that because we can bring them in. But these will be very interesting to political makers as well as insurance. So yes, it's very much indeed. I thought very hard to make sure that it fits into the US model or any economic model.
Giuseppe, there is another few questions, but I start for the Isabel question. How does exporting med diet products to the US affect the med diet patterns to sustainability?
It would significantly increase it because they would have an additional revenue line, a different revenue line, not only bigger, but with different seasonalities, different cyclicalities. Therefore, the addition of a different revenue streams in economics basically results in higher economic resilience. It would improve their ability to invest, train. Overall, it would be a significant increase in resilience. This is born out of any economic and enterprise development models.
What do you think is telling Manuel Montoya? What do you think stop Americans to leave the Mediterranean diet?
You mean why they would not want to, or why would they want to stop it?
Why I think why they would change your style of life into the Mediterranean diet. I think so.
Yeah. Easy. 13% diabetes, 40% obesity, death rates that are skyrocketing, mortality rates that are increasing, life expectancy that are decreasing. So all of the incentive at the individual, at the insurer, and at the policy level are to adopt a better lifestyle. The US has been fighting this since at least the 1970s, where the food consumption in the US in 1990s, that's the last time I looked at this data, was 40% higher than the 1970s. It's probably now twice as high. So we have a second pandemic in the US of diabetes and obesities that lead to very high mortality rates via cardiovascular disease, kidney disease. Basically, we are considered a rich but sick society.
When you were talking before on Naples University, you talk about the partners in the project, right?
One of. There are many. There will be many. This concept will be the core, and this is something that the EU is very interested in, is not only a concept based on agriculture, healthcare, tourism, but partnership along all these sectors. So this is a partnership concept. Mm-hmm. Does that answer your question? Okay.
Yeah. Yes, because I think the question is, of course, as you are saying, is a cultural behavior attitude. So there is a strong work in campaign to educate the changing of a behavior in the US, normally in people not knowing the Mediterranean diet. There is another question about that concerning also the identification of a Mediterranean diet in terms of countries. And Neus from Barcelona is saying why some countries are from the American seas as more Mediterranean than others. For instance, Italy and Greece for the olive oil.
I suspect that is a function of legacy marketing and distribution in the US, which basically then creates a concept of some countries being more Mediterranean than others. We will address that. Now, remember, we will not be going through our distribution vectors. Our targeted markets will not be the average consumer. It will be a small percentage of the diabetes and obesity population that are in need of medical interventions. So the ones we need to convince market first are the medical professionals, basically the preventative medicine line of healthcare, and then their patients, and only a small part of the patients. So the marketing is much more doable, much more targeted, and while it will need sophistication, it is much more addressable.
Darko from Slovenia, what about bringing Americans to EU and treat them here? So this is the second part of your proposal, I think.
Exactly. So the idea
is, yes. Sorry, because I have another question that is related to that, and that is by Elisabetta Moro, that is representative of the University of Sor Orsola Benincasa, partner of the project. And she is telling about how do you think we may make more relevant the role of culture? I think that both the questions go to the import of people here in the Mediterranean to see what is exactly the Mediterranean diet. That is culture, that is territory, that is food, but not only. So, yes. Sorry.
So I think you hopefully, we are all, I think, in agreement that the treatment is not just a you don't treat just the body. You must educate the patient. You must in order for this to work, trust me, I've gone through it. And I fight this in the US with the foods here and the culture of just work. And these are the concepts, be they healthcare, be they culture, be they lifestyle, that we will share, educate the patients, and that will be the revenue lines of the businesses. Remember, I am an economist. I do economic development. It will be the partners in the healthcare business that will address that. It will be the partner in the agricultural business that will address the quality of foods. It will be our partners in the culture that we will need to bring in, because we will not be able to hold those patients more than a few days in these centers. They will need diversion, entertainment, but also education. These things are an integral part. One must go with the other. So if you miss one, it's like trying to make soup without water. It just doesn't work. You need all the good ingredients together.
Yes, yes. The education is very, very important. That's why the research must to go to the territory and to give the people to information and basic
Yes,
concept to change the behavior, the attitude.
good. So now,
But
now you see how these things leads from the foods to the treatment to the culture to the tourism to the retirees. One leads into the other. Thank you.
there is Jordi from Barcelona is asking about governments need to urgently adopt policies that make a healthy diet easily accessible and affordable. How can we achieve healthcare sustainability? That's true because
Okay.
you told us before the diabetes is very weight in terms of cost for people, for example.
Yeah. Okay. So this is how we will, I think, we will do it. I will just talk about what I will do. I'm an economist that specializes on advising governments on their policies around the world. Right now, I focus on SMEs. But with this project, my contribution would basically to lay out the economic pains, disadvantages, and costs of these diseases. Right next to that lay the economic advantages, the cultural advantages, the tax advantages, the healthcare advantages, the additional life and taxes throughout the years of their citizens, and say, okay, you make a decision. You can pay all this and get nothing out of it. You can pay a fraction of what you already paid and get much more. Simple story. Usually I get policymakers to think about this.
You know what I'm thinking about that? There will be immediately next years very strong policies by Europe, by the European Union, concerning the healthcare, and it's something that I put in the box to think about. It can be also basic for our potential working group to prepare something to have from Europe also financing to to go to implement Mediterranean diet uh, healthcare as a solution, as a something to help a more balanced style of life. So what I'm saying that Europe will be the potential funds financing for something that can be proposed on the dissemination of Mediterranean diet culture.
I agree that Europe is much better prepared to have a sustainable healthcare system, including preventative treatments. Germany has them, other countries have them. In the US, things are changing very rapidly. To give you an idea, the Republican Party, the conservative Republican Party, has implemented legislation which is very close to a universal basic income for every citizen. This was 6 months ago, this was described as a socialist fantasy, and the Republican parties implemented this. They also implemented free healthcare for the pandemic, so we are not that far away. So the pandemic has changed the culture, private as well as public paradigms.
There is Ana Bulicic from Croatia. What is your perception on what is the percentage of the population in USA that are aware of the med diet eating habits? Is it possible to go for some new eating habits campaign in states instead of sugar-free, fat-free?
Mm-hmm. Okay, so let me just follow up on the question before and then answer this. So out of the economic model that are based on enterprise development, out of the export business, out of the import business lines, we can come up with regional business, regional revenues, as well as national savings. This is what I do as part of my business. Now, as to the capacity to change the U.S. general population perception on the Mediterranean diet, I do not think that that is what we want to do as the first thing. Eventually we might, but remember, I have specifically designed this product as a target, or these two concepts, as targeted concepts directed at the diabetes rich population in the US, if the insurance company will be the diabetes population in the US, and the vectors of communications, the ones that will decide who of these patients or which of these patients will purchase these goods and services is the medical industry. So they are the ones that we have to first educate. And they are very aware. They read the literature. I have not met a doctor that does not understand and agree with the benefits of the Mediterranean diet. The targeted, so that will be the primary target. Then we can go with brochures and marketing to the diabetes and the obesities. They are, for example, the American Diabetes Associations that can be a partner with us. But again, I do not think that these economic projects that I am proposing are based on the general understanding and the general consumer market. They are a targeted concept, targeted to a subset of the diabetes, the ones most in need. Basically, my doctor said, if you don't do something about it, you're going to die in the next 10 years. That's the market that we are going to go after.
Elisabetta, always from University Suor Orsola Benincasa, is provoking you. If you could invest 1 million euro on one university research, which item would you choose?
Okay. From the basis of this project, I would focus the research on the certification process. Then it'll be at least a 3-phase research approach. How to ensure that the process, which for the most part is already developed, is ready for regulation and implementation. That is the critical linchpin to being able to produce certified medical foods and certified medical treatments. These, remember that our approach is a targeted approach. The concept is medical foods, medical treatments based on the Mediterranean diet, culture, and climate. So that is what I would focus. It would be to take the academic medical research, which is already existing. We have more than 40 years of observations on who is treated, when is treated, who follows, who doesn't follow, how well does it work, how well does it work 10 years from once they start, etc., etc. That data is already there. That literature is already there. They've already started the regulatory or certification process. The research now should go forward towards ensuring that regulators can adopt it and then that firms can implement it. And governments then will also work in this area as well.
This is a very, very interesting theme for research to apply to the European Union to promote Mediterranean diet in that terms. Elisabetta is saying yes, yes.
Well, you know, I've always been...
So we have to prepare a new working group, huh?
No, I think that will be part of the operational working group. The operational work group, they will have a scientific arm. And that will be critical in all this. It's not just starting the business side, but the business and scientific has to go side by side. The business and the culture has to go side by side. The business and the tourism has to go by side. The logistic has to go by side by side. You can't have all these silos. They have to be working together.
So, Giuseppe, everyone says this is a really, really interesting speech. I think we should go ahead and we should meet again to work on our potential project together. I would finish now if you don't have any other issue that you want to define with you want to give us some other suggestion. And Giuseppe?
Yes, I'm here.
I know, because I see something else in the presentation in the screen. And I would finish with a manual proposal that says Americans are wrong when say an apple a day keep the doctor away. Let us show them Mediterranean diet today keeps the doctor away.
Absolutely.
So thank you very much, very much, Giuseppe, and we will keep in touch to work together on this working group. Okay.
Thank you, and I look forward to our discussions.
Maybe you will contact your contact point in a university. What you mentioned before, I will contact the University of Suor Orsola Benincasa, and we will meet together. Okay.
Absolutely.
Okay.
Absolutely.
Thank you, Giuseppe. Thank you all. It's a pity that there was maybe some difficulty in the link, because I see that there is less people than in the other webinars.
But we have recorded the presentation, so we will disseminate it and make sure, because it's a very good presentation. Myself, I'm very much motivated in we should go for, and I'm very excited about it.
Yeah. I will be delighted to do it again with different audiences. So I am available for you, with you, and as you can imagine, I am very.
We will discuss with the partners for that next steering committee on 3rd of July.
Thank you.
Thank you, Giuseppe. Thank you
Arrivederci.
all. Arrivederci. Ciao.
Ciao, ciao.
Arrivederci. Ciao.
Ciao, ciao.